Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.
Well, do you suffer from joint pain or knee pain like many of us do, especially as we age and we've been, somewhat active throughout our lives, and then as you get older, you seem to suffer from some of those pains. Well, joining us today is Dr. Maryam Rahimi, and she's with Emere, and you're located right down the street from us here in Laguna Hills. Thanks for joining us on the program.
Thank you so much for having me. We really appreciate it.
You bet. Before we start talking about some of the pains that a lot of people suffer from, let's talk about Emere. You seem to be unique in how you treat pain.
Well, we hope so. We really try to provide more of an individualized, customized treatment for our patients. We genuinely care for our patients' success, and we want to provide patients who suffer with any type of muscle or joint injury the freedom to do the activities they enjoy and love. And through our non-surgical regenerative treatments, we've had excellent success, and patients can return to a more active and healthy lifestyle without necessarily the need for surgery.
Right, and the key word there you just said was non-surgical. So you're really trying to treat the pain without, having surgery, obviously.
Yes, we have an arsenal of regenerative treatments to include joint fluid therapy, PRP, which is platelet-rich plasma, stem cell injections, which we also offer currently, and as well as a customized rehabilitation program, bracing, really just a very multimodal approach to treatment of different types of musculoskeletal and joint pain injuries. Yep.
So you can help those kind of people that have been kind of suffering through pain and maybe not going on that walk anymore or playing that activity anymore, and kind of just going through that suffering each day with the pain, and you have many treatments that you can help them with.
Absolutely right. We see so many people who suffer daily and don't think that there are other options available to them. They don't want to do surgery, and maybe, for instance, a patient who has knee pain and who is a 50-year-old individual who has difficulty walking or standing or has challenges rising from a seated position, and they've gone to their primary care doctor and have tried over-the-counter anti-inflammatory medications, and it hasn't worked for them. This is an ideal candidate for someone who can come to Emere and see one of our specialists, because we can provide injections, whether it be cortisone injections or something called viscosupplementation, which is like a lubricant for the joint.
Right.
And so the bones aren't grinding, but rather now they glide over each other. And it's called hyaluronic acid, and that's a naturally occurring compound within your joints. And when we inject that into the knee, it provides it causes your body to start creating more of that hyaluronic acid and is a wonderful lubricant for the joint.
Well, especially knee pain. A lot of people suffer from knee pain. So at what point when you're just you're feeling that discomfort and you just feel, well, I'm getting older, so you kind of just grin and bear it. At what point do you actually need to get into the doctor? I actually read something on your website, which was, I thought, great. It talked about cavities, because people can relate to that.
Yeah.
You have a cavity, you go to the dentist, and you get it taken care of right away. And if you don't, your teeth will rot, and then you're in a lot of trouble. And arthritis and knee pain is similar to something like that.
Absolutely. So arthritis is just a disease of age and time, and everyone, unfortunately, we wrinkle, we're going to have this degeneration of the tissues. And 27 million Americans are affected by osteoarthritis. And so we're seeing this quite often in the clinics where patients have pain. And they don't need to be, because we can offer them these injections, we can offer them physical therapy, and we also do a lot of patient education. We partner with the patients to provide them with the tools that they need to live a more healthy and active lifestyle. One of the things is that if a patient just loses weight, each pound that you lose takes 4 pounds of pressure off your knees.
Right.
And we sit, myself, the nurse practitioner, the other highly trained clinicians, spend the time to discuss this with the patient, to educate our patients, because we partner with them for their success.
Right, and that's a change of lifestyle and nutrition, obviously, and that will help you get through this pain.
Absolutely. Lifestyle modification,
Yeah.
good nutrition, good diet, continued exercise. We see that patients who exercise more and not necessarily live a sedentary lifestyle have stronger muscles and lean body mass later on. And so we just educate our patients and work with them. Plus, we provide the state-of-the-art technology, the state-of-the-art medicine, the state-of-the-art injections so that they can get better.
Right. Let's talk about neuropathy. That's been very well talked about in the last few years as well. That is something you can treat as well.
Yeah, we have a lot of patients who come in and complain of numbness and tingling in their arms, or you have patients who say that they have sciatic, which is a sharp pain running down the back of their legs. And so at Emere, we have electrodiagnostic testing where we can actually find out where your nerve is being affected. Because if you have numbness in the hands, it can be entrapped in the wrist, it can be compressed in the elbow, it can come from your neck. And so this test that we perform gives us the exact location as to where the nerve is being affected, and then we can give you a rehabilitation program to better treat you. More importantly, we can provide injections into the wrist for carpal tunnel, or into the neck if we have to, or even into the muscles if there's a muscle spasm that's causing some type of triggering. And so not only can we diagnose, but we can very effectively just as easily treat.
Is that usually from a physical activity, or is that from, like you said, an aging process?
So neuropathy is primarily from when the nerves become compressed. So if you are a receptionist and you're typing a lot and have a lot of repetitive wrist movements, you can develop carpal tunnel.
Right.
If you're a truck driver and you put your elbow and you sit like this and put your elbow, you can develop entrapment at the elbow. And of course, neck pain is very common, and what we call a pinched nerve in the neck. And if you're a diabetic, you can also develop neuropathy of the feet, which is a very painful condition and debilitating in many cases. And so at Emere, we're able to find out why you're having the pain, and more importantly, we can treat you effectively so that you feel better.
Right. Another common ailment is back pain. Everybody seems to suffer from back pain, especially as we get older.
Yes.
And whether it's a sports activity or just working out in the garden, a lot of people suffer from it.
You're absolutely right. So 90% of Americans will seek the service of a physician for back pain at one point in their lives. And the body is a biomechanical unit. The knees, the hips, the back, we're all connected. So if you're walking with a limp, more than likely you're going to develop some type of back pain, knee pain, hip pain. And what we do is that we find out why the pain is being caused. Back pain doesn't necessarily have to come just from bones. It can be muscle tightness and spasm. It can be from the ligaments. It can be from the disc. And so we hone in on finding the accurate diagnosis. And at Emere, beyond that and beyond treating, we address the biomechanical problem that's causing your back pain. So we look at your knees, we look at your ankles, and we have just phenomenal physical therapists there who work with me and with the team to strategize and provide an excellent exercise program for the patient so that they can get better.
And that's great. I like your slogan too. It's changing healthcare. Like you said, it's non-invasive, and you're trying to get people to, manage their pain in these different treatments without going into surgery, the rehab process of that, and the infection that can possibly happen. So this is a great opportunity for residents to come by if they're suffering from any of these ailments, to come by and see you. You're located right on Calle de la Luisa, and right next door to us here in our community. So we do encourage people to come by. You also have a website too. They can go to Emere online.
Yes, emere.com. And if the residents have any type of pain, we urge you that they come in and get a consult with myself or one of our practitioners, and then we can give them an honest evaluation and see if our conservative treatments can help them.
Right, and I like that. I like what you just said, your conservative treatments, because nowadays people just want to give you medication and then get you ready for the next surgery or something like that. Well, that's Dr. Mariam Rahimi, and she's with Emere, located right here in Laguna Hills. Thank you so much.
Thank you for having me.
Great information this morning that I think a lot of people in our community can utilize. Give them a call as well, 610-1040. That's a real easy phone number to remember, 610-1040, located right down the street here on Calle de la Luisa. We'll be back with more of This Day in Laguna Woods Village right after this. Good job. That's
Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.